Hey guys, what's up? Welcome back to Simplified by Jinal Shah. In this video, we are going to study a drug called as Spigelia. If you watched the previous video, which was in Sanguinaria, I mentioned that we're going to do a drug called Spigelia and they have some similarities. One of which being that drug, that is Sanguinaria, was called as, the common name was bloodroot, whereas this guy is called as pinkroot, everybody's favorite. Now before starting the video, I would like you all to subscribe to the channel if you haven't already. We are a family of 3K people now and I hope you are a part of it. Spigelia and Sanguinaria have one thing really common in them, and that is the headache part, right? हमने जैसे sanguinaria में पढ़ा था, sanguinaria has the letter R, which is why it is right sided, whereas spigelia has the letter L, which is why it is going to be left sided. Okay, so this is the basic difference which is clear. Apart from this, how we're going to approach this drug? By its name, Spigelia. अगर इसको हम ध्यान से देखें तो it is spy and gelia. We are going to break it as a spy, right? नाउ ये दो मैग्नीफाइंग ग्लास है, इसको मैं थोड़ा और अच्छे से ड्रॉ करूं, then it could look like, I mean, the whole purpose of magnifying glass is to see clearly. So with that, we can correlate that there is going to be a part which is related to eye. Now, as I've already mentioned, it is a left-sided remedy. So the orbit or the side of affinity is going to be left, right? So by the word spy, we see two magnifying glasses, which tells us that, oh, this could have something related to eyes. We already know that the letter L represents the left-sided, and so we have affinity towards the left side. Now, the other thing which we said is common in Spigelia and Sanguinaria is the headache. So let us see about Spigelia headache. Okay, so the headache is like a band which is felt like here. Most of the headaches which are like band can be stress headache or tension type headache, where it is because of the muscles which are undergone a contraction. So you have a band headache. Um, Time affinity similar to sanguinaria, from sunrise to sunset. You can see this in the diagram. From sunrise to sunset, highest peak in the afternoon, as if a band around the head. Now, apart from this, since it is a left-sided drug, we have headache from base of the head settling over the left eye. So if it is, let's say, from occiput, it is settling over the left eye. If it is from temples, it is still settling over the left eye. So from anywhere, so there are two types of headache. One is a band-like headache, which is right above the eyes, and second is a radiating type of headache, which may start anywhere on the head, mainly from the base of the head, which we count it as occiput, and then rests on the left eye. So it will settle over the left eye. One point which we missed in the eyesight was dilation of pupil. Um, Now, if you know a bit about physiology, pupils usually dilate when they want more light to enter in. That is, they want to see something more clearly, right? If you want to see something more clearly and you are unable to do it, so your pupils will dilate so that more light can enter into your eyes. So here, since this person is a spy and since he wants to see things more clearly, he'll have to dilate his pupils. Easy to remember. Moving on to the next point is try. Now, this can be a bit of stretch, but we know हम लोग stretch वाला भी पढ़ लेते हैं. Spy, S-P-Y. It has three letters, S, P, and Y, which we will correlate as try, right? And from tri, we have a nerve called as trigeminal nerve. Now, trigeminal nerve, let me remind you, is not the third cranial nerve, but it has the word tri, which means three. And the word spy has three letters. So that is how we are going to correlate. There is some relation with trigeminal nerve. Now, if it's not the third cranial nerve, then why the hell did we label it trigeminal, right? Because it has three roots. Okay, so the word spy has three letters. From that we will remember trigeminal nerve, and trigeminal nerve is labeled tri because it has 3 roots. So first root is ophthalmic or the branch, ophthalmic branch. Then we have maxillary and mandibular. So in this phase structure, we know that nerve innervates these particular area. There's an ophthalmic area, there's a maxillary area, and there is a mandibular area that's near the lower jaw. Now, what the drug covers is a type of neuralgia. Neuralgia is usually pain due to inflammation of nerves. So this drug is going to cover neuralgia in the sense that it's going to cover all 3 innervations or supply of trigeminal nerve, be it ophthalmic area, be it maxillary area, or be it mandibular area, right? What is the type of pain here? The person is extremely sensitive to pain, and the pain is shooting, burning, or tearing type of pain, which is aggravated by noise. Right? You remember we did similar thing in sanguinaria as well. Anybody who remembers, please write down in the comment below what is the difference between neuralgia or spigelia and sanguinaria. Right, so in this area you can understand there is an affinity towards orbit and eye, which we've already seen, more towards left side. Then in the maxillary area and in the mandibular area, more towards left side since it's a left-sided drug. How is the pain? Sensitive, extremely sensitive to noise, shooting, burning and tearing type of pain. Now, we had a great professor in physiology. His name was Dr. Nanabhai, everybody's favorite, and he taught us examination of nerves, right, alongside other things in physiology experiments. And if you know even the basics, you know that we examine a nerve based on a few criteria. Here, because it has only, it doesn't have a motor affinity, we will check for its sensitivity, right? So that goes with temperature, touch, pressure, and pain, 4 main key points. Here, we are going to see the nerve with the similar key points. Remember how you examine a patient. If I were to examine a patient for pain, we usually do it with needle pricks, which are very minute, it's not hurtful, and it's only done to see if the person can feel pain in that area. Imagine a patient with trigeminal neuralgia. He is definitely going to feel a lot of pain because there's heightened sensitivity. There could be either of the two representation, either heightened sensitivity or complete numbness. In neuralgias, we usually experience heightened sensitivity. So this guy with trigeminal neuralgia needing Spigelia comes to you and you check for pain, and you bring the needle in front of him trying to examine, and he's going to be fearful, right? He's going to have fear of pins, he's going to have fear of needles and all pointed objects altogether, because possibly in the past he's had an experience with the pointed object and it has given him a huge neuralgic shock, right? So one point is clear: pain unbearable because of extreme sensitivity. Is going to be fearful. Now we go to touch. Touch, even the touch of water is aggravating. If we were to classify more in terms of temperature, then cold air and cold water would be an aggravating factor. So if we were to examine in terms of temperature, cold is a no-no for this patient. And then lastly, we come to a characteristics modality which we could not actually figure out. Why is the person very sensitive to tobacco smoking? So Spigelia patients would not be able to tolerate a tobacco smoke. Okay, so I'll just put in a small star mark here because it's a characteristic symptom. If anybody can explain me the physiology behind it, please help us in the comment section below. Now, since these are the aggravating modalities, they would also hold true for the other symptoms, that is the headache. Headache is also going to be worse with all these modalities, explaining to us that we should not restrict the headache just to the tension type headache or stress headache, but we could also include neuralgic headaches in the headache portion of Spigelia drug. Headaches are worse with motion, worse with noise, and worse with touch. Alright, so far we are clear with it. We've mainly covered this Spigelia drug. If you've watched until now 10 minutes of the video, great job. You've almost covered 90% of the drug. If you know this, you can definitely cure a patient with Spigelia if of course the symptoms match. If you watch for the next 2 to 3 minutes, you will be a master because you will know the part which not most people do. That is about the heart affection of Spigelia. Remember, Spigelia is a good drug to write in CVS theraps, that is for 4th year in your cardiovascular system theraps. For Spigelia has an affinity towards your valves. Okay, so imagine this is your heart. This is the left ventricle. These are your bicuspid valves. This is the ventricle. Now this is purely pictorial for your representational and pictorial memory. Since it has rheumatic vascular illness, we know a bit about pathology of that is there is going to be some vegetative growth on the valves. Here you see in this diagram I've drawn these two eyebrows representing vegetative growth on the bicuspid valves. I've drawn mini eyes on the valves, and the ventricle I've drawn them teeth just because there's one word which says roaring heart, and I had to represent it in a way that it looks dangerous, so you remember the word roaring. Okay, so it has rheumatic vascular disease mainly with vegetative growth on valves, but it could also have endocarditis and pericarditis, so two other illnesses as well. What are the symptoms? Yeah, so the heartbeat, mainly we'll have symptoms with heartbeat and heart sounds, that is murmurs. We could either have an irregular heartbeat, we could have violent murmurs, we could have, roaring heart murmurs, that is extremely loud. We could have blowing, systolic blowing, which is again a heart sound that you could check out. So there's going to be some irregularity with heart sounds and heartbeats. All right. Now, since there is a heart affection, the person might have dyspnea in the later stages. And let us also see the dyspnea characteristic by this picture. Now, the dyspnea of this individual is associated with pain in chest, and the person must lie on the right side, which is head held high. So there are two things: dyspnea with pain in chest. How does he feel better? By lying down. Now, what is characteristic in it? Now, usually if you have not dyspnea per se, but if you have giddiness, let's say, then we tend to give a head low, right? For dyspnea, we put a propped up position so that the heart and the lungs are not completely bent on by the diaphragm and the abdominal content. This patient, this Spigelia patient, he has this weird thing. He wants to lie down, right? So he doesn't want the propped up position, and he doesn't want the head low position as well. He wants the head high. Okay, so he wants the two most opposite thing which you would usually do. He wants to lie down as against to propped up position, and as against to head low he wants a head high. Must lie on the right side. Okay, this is again an important thing, must lie on the right side, because otherwise you would think, oh, left sided drug, you would want to lie down on the left side, right? So with this we have finished the drug Spigelia. Mainly Allen's notes are covered, but if you know this much, you know 90% of the drug for sure. You watch this video 3 times because try is when enough. I'm pretty sure you're done for life with this drug. Let's quickly revise it. Pink root, spy, dilated pupils, headache, sunrise to sunset, settles over the left eye. Trigeminal neuralgia, we examine the patient, we write down the branches and the paths which it supplies. We come to the heart part, we know it roars, we know there is some eyebrow structure, and then we know how weirdly he wants to lie down. And that is it, your drug is done. So I hope you've understood the video. I hope I made it at least 30% easy. And if you've liked the video, if you've watched it so far, thank you a lot. Please comment down if there is any other drug suggestions that you would like me to cover, any group of remedies or any particular remedies as well, and subscribe to the channel for more such creative and simplified videos. Thank you all.